everybody. Thank you for being here today. Today we're going to talk about the testing that was administered to Katie. We know she's been having some difficulties, especially in the parents had concerns in the reading and language arts area. And so she was given a battery of tests. And so we're going to kind of go over her scores and what those scores mean. I'll just kind of go over an overview really quickly of each test, and then we'll kind of talk about what all of that means. So first, she was given a test called the Wechsler Intelligence Scale, which is a cognitive test. And this told us that she has a low average IQ of 80. Her verbal skills fell in the average range. Her visual spatial skills fell in the low average range. And her reasoning and working memory skills were low and extremely low. So we definitely have some concerns there. A language test that she was given was called the SELF-5, the Clinical Evaluation of Language Fundamentals. And this was a test for her expressive and receptive language. Her ability to process was in the average range with a score of 100, but her word classes score was a 7 in the below average range. For adaptive skills, which measure her oral language proficiency and skills, she was given the test of language development, the TOLD 1, and the TOLD I, test of language development, the intermediate edition. Her speaking and grammar skills were in the 5th and 6th percentile. Her organizational skills fell in the 10th percentile. Her listening skills were in the 18th percentile, as were her semantic skills. And her spoken language skills were right on par with her speaking skills in the 6th percentile. The academic achievement test that she was given was called the Woodcock-Johnson, and this is going to measure her academic achievement in reading, math, writing, academic knowledge, and oral language. So, in her abilities with multiple meaning words, she scored a 9, which is in the below average range. Her broad reading score, which is kind of like a mean score for the reading portion of this assessment, was in the low average range with a score of 87. Her math score was in the average range with a 95. Her written language and broad achievement scores were both in the low average range, and her oral language skill was a 25 in the average range. We also wanted to check any attention deficit disorder tendencies that there may be. So she was administered a behavioral test called the Addis 4, which she was given one of those for at home and at school, which some kids can act differently at home and display different behaviors at home versus at school. And there weren't really any problems noted there. She fell in the average range with a score of 91 at home and 94 at school. Her teacher did note that when she doesn't understand, she tends to kind of, her mind kind of seems to wander because she's just not able to complete the work that she's given independently. And then lastly, she was given a learning disabilities evaluation scale, which is mostly for educators to be able to identify students with learning disabilities. This test was very beneficial in identifying the needs that she may have. This measured her thinking, reading, spelling, and mathematical calculation skills. There was a pretty big need in spelling and reading. She fell in the 4th percentile in reading and the 7.07% in spelling. Her thinking skills were in the 13th percentile, so we know that there's information going through her brain. And in the mathematical calculations, she fell in the 1st percentile. So this tells us a lot as far as we know the information is in there. She just is needing some help processing it. So just kind of like summarize what we just went over. It was noted that she has difficulty problem solving and is often frustrated with her ability to perform academic tasks. And her ability to formulate sentences, such as a simple sentence or even a compound sentence with errors, is in the low average range. So her ability to spot those errors and fix them is low average. She's able to correctly identify relationships between words in a category some of the time, but not always. And then again, her ability to spot a sentence that has grammatical errors and be able to fix those errors was very low. Sometimes she sees a correct sentence that doesn't have any errors and wants to try to fix that. So that's an area that we need to work on with her. Identifying words that have multiple meanings and how words are used to make sentences is very poor. So it's very clear, from the findings of these assessments that she possesses a language impairment. Her difficulties in reading and language carry over to math with word problem solving. This also includes her ability to write and her spelling and grammar skills. So despite all of these difficulties, her verbal comprehension is in the average range. So this shows again that she's able to understand, but the application process is a struggle for Katie. So her abilities to name picture items is a strength, as is her ability to recall sentences. And she's able to use vocabulary words correctly in sentences, but is sometimes not able to tell what those words mean if she's asked to define them. When Katie was tested, she was able to display proper turn-taking abilities and demonstrated good receptive language and conversation. She was able to express her wants and needs appropriately to the test examiner. And there were no concerns noted with inattentiveness or hyperactivity by the testing examiner. So my recommendations going forth is that she is given reading passages on the 2nd or 3rd grade level. We need her to be able to identify the main idea, characters, setting, and author's purpose most of the time. And I think it would be good for Katie to be able to receive writing prompts so that she can practice responding with a sentence of at least 6 words. And our goal that we want to aim for is to have correct spelling, capitalization, and punctuation. As far as her reading aloud to others, we want to shoot for a 3rd grade level text and be able to move our way up from there. So the goal of this is to be able to improve her expressive and receptive language skills. And then a last recommendation that I would like to offer is that she is given grade level word problems as far as the content of the computation, but maybe we take the lexile level down a little bit with that so that she is able to show understanding with that math vocabulary and is able to solve them, but just on a maybe lower reading level. So that kind of wraps up her testing and kind of where we're at with where we're going to start working with Katie. And we will definitely keep you updated of any changes, or if you have any questions, please feel free to reach out to any of us. Thanks so much for coming today, guys.